Good afternoon. My name is Steve Bloom. I'm president of the board of directors of the CLL Society, and I'd like to welcome you to the continuing coverage of ASH 2021 review of key abstracts and posters from the meeting that was held in Atlanta, Georgia this past December. Today we are joined by Dr. Alexey Danilov from the City of Hope Medical Center in Duarte, California. I'd like to ask Dr. Danilov to quickly introduce himself, and then we'll get on with the review of this poster from the meeting.
Hi, Steve. Thanks so much for having me over. And my name is Alexey Danilov. I'm a professor of hematology and stem cell transplant at City of Hope, where I lead the Lymphoma Center. And I'm happy to be here.
Great. We're happy to have you. So we'll take you back in time to December 12th at ASH in Atlanta. And you were the lead author on an abstract that's entitled, this is a long one, Final Results of Phase 1/2 Study of SYK Inhibitor, entospletinib, in combination with obinutuzumab in patients with relapsed refractory chronic lymphocytic leukemia. And as we know, therapeutic resistance and intolerance of BTK inhibitors is an emerging need in CLL. And it seems like SYK is integral, and you might want to explain SYK to the audience, but SYK is integral to the activation of BTK and the B-cell receptor signaling cascade, and seems to be overexpressed in CLL. What exactly does this mean? What is the importance of this study for the audience of patients and caregivers interested in CLL?
Yeah, thank you, Steve. So SYK is a kinase in some ways similar to BTK. As you know, Bruton tyrosine kinase or BTK inhibitors are used in therapy of CLL. So they include ibrutinib, acalabrutinib. There are also positive studies of zanubrutinib in CLL. So though they are BTK inhibitors. And in fact, SYK is the kinase which sits above BTK in that pathway and is essential for activation of BTK. So in fact, it is the key kinase which transmits the signal from the microenvironment down to BTK and other kinases through the so-called B-cell receptor. So SYK has always been a very attractive target, and SYK is just short for spleen tyrosine kinase. So it's always been an attractive target. And several drugs have been developed to target SYK, and entospletinib so far has been the most selective. And this study explores entospletinib in combination with another well-accepted therapy in CLL, obinutuzumab, which is a CD20 antibody.
And let me ask you to expand a little bit on I'm going to try and pronounce this drug, entospletinib. That's the best you're going to get out of me. Is this like a prodrug, or how does this work? I mean, you said it sits on top of BTK. Yeah. What exactly does that mean?
So the drug inhibits SYK, spleen tyrosine kinase, and basically just like ibrutinib, it disrupts the signal coming from the milieu of the CLL cell, and that thereby inhibits CLL cell survival. So, we in this study, we have observed good responses in patients with CLL. Basically, all patients derived a clinical benefit, and the majority of patients had a response. Just like what we see with the ibrutinib and other B-cell receptor kinase inhibitors, we didn't see a whole lot of complete responses. So the disease did not disappear, but it was well controlled. I think what sets entospletinib apart is its very favorable safety profile. So it is not known to be associated with atrial fibrillation or hypertension, what we see with BTK inhibitors, and we haven't seen any of these complications on this study. Only 1 out of 21 patients actually discontinued due to an adverse event, and that was mild liver function test abnormalities, which were completely reversible. But all patients with CLL did really well in terms of their safety profile. So now this drug worked in patients for about 2.5 years. And however, we had a very unfavorable patient population. Most patients, if not all, received chemotherapy. Some had prior ibrutinib, and about 2/3 of patients had very unfavorable genetic abnormalities, including P53.
Okay, and if you had a crystal ball, and this is a phase 1/2 study, what's the progression of a drug like this? And if it continued to show this level of activity and safety, of course, which is quite impressive, as you described, where does this drug wind up, and where does it fit into the armamentarium of folks like yourself going forward? And this is probably 2 or 3 studies or a few years out from approval, but do you have a sense of how this might benefit patients down the line?
Yeah, I certainly think this pathway has room in CLL. This drug has room in CLL, again, because of the very favorable safety profile. In an era where we no longer use chemotherapy to treat CLL, I think development of another targeted agent is very welcome. Of course, there would need to be additional studies run to achieve approval of this drug by the FDA. And currently, we are discussing this with industry, what such studies might be. So okay. I don't really have an answer yet, except to say that so far the data is very good. The safety is very good. The drug has efficacy, and I believe it should be developed further.
Great. Well, it's amazing to see all the different targeted agents and all the work being done in the space. This is just another great addition going forward, realizing that more studies need to be done prior to approval. But thanks to you and your colleagues around the world, it's awesome to see the progress that's occurring in the field. Any last takeaways for the audience? Anything you want to mention that we haven't touched on before we conclude?
Yeah, no, Steve. I think we highlighted the study pretty well. And while we don't really have any slots on this current study anymore, we are not offering it to patients. There is quite a bit of development going on in CLL, so I would certainly welcome any conversations about therapies, particularly when we face an unmet need, patients who progress on BTK inhibitors and venetoclax. Right. We have some exciting new opportunities there for therapies as well.
Excellent. Well, thank you for your time as always, and have a great weekend, and we'll see you around the CLL media channel. Take care. Bye.
Thank you. Thank you.